Nagbabalik tayo sa ating programa. I just want to correct myself. I did mention Washington, pero sa Sacramento po yan because we are talking about the state of California, not on a national level. As we know, there are so many Filipinos here in California, and we are talking to Fitz and to Kiko about this bill. Ang tawag sa bill na to, SB 349, the Dialysis Patient Safety Act. Now, ano ba itong bill na to? And who sponsored this? I know you're part of the organization that sponsored this.
Well, kaya nabanggit ko, like I mentioned, when we called the union to help us, UNAC and NUCHI, that we can do so many changes and really improve our situation, because this patient, we see him 3 days, like once a week, and they're like family to us. So we can do more better, taking care of them. So the SB 349 is the patient dialysis. It's basically improving their situation.
The conditions.
Yeah. So if one technician will take care of 3 patients, and we want that to become a law. And for the nurses, we want like 1 nurse to take care of 8 patients instead of like 1 nurse will take care of the whole facility. Because right now that's what's going on. Tapos, sa social worker naman, gusto namin 1 social worker and it will take care about 75 patient. And tapos, gusto rin namin improve yung transition time, no? Kasi ngayon, parati kami nagmamadali dahil yung short staffing. Pinagmamadali, parang fast food, di ba? Parang ka nag-assemble ng burger. But this time, pag naging law, yung 45 minutes, talagang take time. Yung care talaga nandoon, nakakausap mong maayos, okay ka ba? Hindi yung, I'm done. Tapos iwanan mo.
Alis ka na kasi meron pang ibang
kasi tao to yung kadil mo tao.
So, hindi burger.
Yes. On top of that, gusto namin na ina-inspect yung mga facility, at least once a year. Kasi ngayon, na-check lang like 5 years. So, anything can happen in that 5 years time. Kaya kung may consistency at na-check sila, walang mga illegal activities na gagawa, yung mga big corporation. These are big billion-dollar companies, make more money than major hospital in California.
That's right. We want to acknowledge the fact that this is authored by State Senator Ricardo Lara. And I know that you guys have gone to Sacramento several times, Kiko, to talk to senators about this bill and why it's needed. It's passed already the Senate Health Committee and Senate Judiciary Committee. So what's next? So
ipapasala lang sa Senado, tapos it's gonna become a law, which is good.
So one more step to go.
Yeah, then it's gonna magiging siyang batas, tapos pag batas siya, maraming advantage yun kasi hindi mo na pwedeng ilabag. At mas makatao.
Diba? So, okay, it's going to the Appropriations Committee. Sorry, that's a big word for me. And then, as soon as that's approved, it will be voted on, and then the whole California State Senate. Now, let's talk about what the bill does. It establishes ratios, like you mentioned, diba, for RNs, techs, and social workers. Ibig sabihin nun, mas konting pasyente sa iisang trabahador. Diba? Kasi ngayon, ang dami right?
Yeah.
And then you also said 1 registered nurse for every 8 patients. I mean, that still sounds like a lot.
Yes, actually,
doesn't it?
Yeah, because in some other countries, it's actually smaller ratio. And when they came up with this ratio, it's not like out of the blue, it fell out of the sky that, let's come up with this. Yeah, let's harass the big. It's not like that. 9 states, this was passed like similar. And it was great. The workers are more relaxed. Patient outcome is better. And it's actually probably made more profit because they have to open more facilities. So it's not true if this bill passed that workers are going to work 5 days, 8 hours, or they're going to close down facilities. But because there's some rumors going on like that, that's why we're here to clarify that's not going to happen. And especially when there's a solid unity of workers, that there's a resistance. That's the important thing here.
That's right.
Yes.
We live in a day where we have to join the movement, because everything that's happening in our world today, it seems like profit is always taking over what needs to be right and just.
Yes.
And we don't just see that in the health industry. We see that in government. We see that in broadcast. So, so it really is, diba? It's about this.
Yes.
Na dapat hindi.
And UNAC is very experienced union too. They help to yung pass yung law ng ano, no, yung RN to patient ratio, nag-improve talaga.
Oo.
When you hear that Kaiser, you know, when you hear Kaiser, like, yeah, they treat him very well.
Yes, absolutely. I want to say thank you to for coming here and talking about this. Gusto natin bigyan ang ating mga kababayan ng impormasyon para makatulong sila sa bill na to, para siguradong mapasa ito. Diba? So we'll give you those details when we return here on Kababayan Today. We need your help, and we need you to help us to fight for our communities so that we have safer dialysis for patients. Magbabalik tayo.